So good evening and welcome to this NOEL session. As all the trainees and fellows who joined along with the faculties here, where today's session is not about a case presentation, which conventionally we do all the weeks bedside or the presentation from the PowerPoint. Today's session is about how to present a case in the examination, which will be covered and what expected from the students and the examiners will be covered by Dr. Naveen Jain sir. And the theory examination, the art of writing a theory paper. What are the tips there? Dr. Umesh Bhatia is there to take a few minutes of a session to guide the students and the trainees how to appear in the exam and how to rightly to the time period, time splits, how to best use of their knowledge and write it. Probably I'll invite both the faculties, very well-known faculties neonatal in the neonatal area, in neonatal academics group. So both are teachers of teachers, and Dr. Umesh Bhatia, I will invite sir to go for the first session for first 30-minute session. Then the next session for the clinical thing, I will request Naveen Jain sir to come for the clinical part to cover. So, Ms. Bhatia sir, if you're ready, directly you can take over the session.
You can see my presentation.
Thank you for joining, sir.
Can you see my
presentation? Perfectly, sir. We can hear you. We can see the presentation. Okay. It's perfectly fine, sir. The PPT we can see.
Okay, so a very good evening to everyone who's joined, and today we have a very different kind of a session. So in this session, we will be telling you what is expected from the candidates, and it's a very appropriate time to hold this session. Over many years, we have been witnessing the fellowship exams and other examinations, and we exactly know where things go wrong for the students. So we thought that this kind of a presentation will help you in better preparation to face the exam. And I will show you common mistakes that are done by students in the exam, and I hope you benefit from today's presentation. So I'll be speaking a little bit about the theory papers. And before I start, I will just try to tell you about the format which is there in these exams. And in this particular exam, now let us first talk about the theory papers. So theory paper, you have around paper 1 is 100 marks, and you get around 3 hours for that paper. And you've got 10 questions of 10 marks each. Most of the major systems are covered. 1 or 2 questions will be on case-based management. And you do sometimes have a short notes on public health and 1 short note on biostatistics. So when you are reading and preparing, just try to see that you actually are reading a little bit. Those questions are rather simple, but you should be prepared to actually answer them. So paper 2 is an MCQ of 50 marks, of which you get 2 hours. And that is also relatively simple. There are case scenarios, there's some genetic diagnosis, you can be asked some formula, some true or false questions, a lab report, some simple statistics, and an occasional question also on public health. Now, we also in this talk a little bit about IIP. I won't really say must spend much time on this because most of you are from NNF, but usually this we also take for the IIP fellowship all as well. Now coming to this practical thing, you must know how the marking has been done. The total marks to the practical is 200 marks. You have 1 long case of 70 marks, 1 short case of 40 marks. Then you have got OSCEs, which have 20 marks. 2 skill stations where you are given certain case scenarios. So one is NRP and counseling, both are 10 marks each. And you can see the 4 tables. One is drug and instruments, breastfeeding, lactation management, research, X-rays, and 10 marks of an internal assessment, which already has been scored. Now, the common problems that we see here is that we generally see a lot of students doing badly in the breastfeeding and lactation management. So please revise a little. You must know a few appliances. You must know about the pumps. The examiners do ask about if there is less milk, what will you do? What is the kind of, when do you use a nipple shield? When do you use a pallidi? Why not to use a bottle? And they will show you a breastfeeding pillow. They might show you a Haberman feeder. So you must sort of just revise a little bit about this, because if you don't do well in the breastfeeding lactation management table, the examiners really don't carry a very great impression. The other issue that we commonly see is the research table, where some of you may have done some study on which the examiners may ask you something, but it is also possible that you have not presented a poster or you don't have any presentation. And in such situations, the examiners may ask you some very simple questions about research. And we have seen that a lot of students falter on this table. People will ask you what do you mean by bias. Sometimes they will ask you about why do you need a sample size calculation, then what are the levels of evidence. So the questions that are usually answered at a fellowship level are not that difficult. So you must either sort of be ready to discuss your poster or presentation or publication that you have done, or you should be able to answer simple questions in case you have not done any study. You must know the basics of research. So this is another area where I've seen that some students are not doing so well in these marks. So I will skip this, but I have to just tell you that performance on that particular day matters. So you can see that, you can say Ajinkya Rahane, a very great player, but on a particular day, you might really do very badly. So be very sure that you have worked hard on this. And on the particular day of your practicals, you have to do well. Remember, the examiners may not know you. You have gone to another center, so they do not know your background. You may be a very sincere student, you have worked hard, you have a reasonably sound knowledge. But on the particular day in your long case, if you falter or don't do well, unfortunately, they cannot help you too much because they don't know you. And that's why I tell you people that, you're expected to finish well. You've had a long tenure, 1 year, 1.5 years. But, in your currently we are in the middle of the IPL. So you have to finish off well because you scored very well in the first 10, 15 overs. Last 5 overs, you flop. You don't really do well. So do very well towards the end, and your performance on that day really matters. You must also know that the in fellowship, at least what we have seen is the student has to give an examiner a good reason to fail. The examiners are not there to fail you. They're assessing how much you know. But if we see that a particular student is not answering questions on CPAP, or he falters with hypoglycemia or breastfeeding or basics of nutrition, I think there the examiners don't take this lightly. These are very simple things. I've been through many fellowship exams. I've seen my colleagues as examiners, and the questions that are asked of fellowship candidates are extremely, extremely simple. So I remember a candidate was asked about the science of intestinal obstruction, and the person could not answer. Then one candidate could not say how the head circumference increases after birth. A child was lying in a hypotonic posture and he said normal tone. So the examiner will ask you that, are you sure the tone is normal? So when the examiner asks you that question, it means that maybe there is some issue in your answer and you are given an opportunity to correct it. So I'm sure you have seen the Kaun Banega Karodpati very often. And in that, if the answer is not right, then Amitabh Bachchan says that, आपके पास 3 lifeline है. तो आप चाहे तो lifeline use कर सकते हो. So he gives you a hint that your answer is not right, and you may review your answer. So always take that hint from the examiner. I remember that candidate, when I asked him again, is the tone normal? Are you sure about it? He kept on saying it is normal. So if you can't assess tone, you don't know how your head circumference increases, you don't know about intestinal obstruction, you don't know the mechanism of CPAP, you do not know what is CPAP failure. I think these kind of questions, if your candidate doesn't answer, then the examiner will go ahead. But if you know your basics well, in a fellowship, they'll not ask you in detail about research studies. They'll not ask you about Cochrane reviews, but they will certainly check your basics. So remember, your basics have to be pretty sound. Now, the issue is, why is this theory important? What we have realized over years is that our experience with theory papers has been very unsatisfactory and disappointing. Remember, theory and practical have nearly equal marks. The theory performance is reviewed by the chairperson in borderline candidates. So the chair will see both your theory and practical and then take a call. So your theory is important. If you've done marginal in the practical, but your theory is not good, then you're more likely to fail. But you've done very well in theory, the chairperson may consider passing you. Theory needs independent passing. So there are candidates, we remember, I think last year, virtually out of the entire pool, around 10 to 15% of candidates had failed in theory itself. So then the practical has no great meaning if you have not done well in theory. Theory papers have independent examiners, so you have to pass separately. And we allow maximum 10 grace marks, usually 5 in theory and 5 in practical. So remember that if you fail there, you really fall below the line, then you can't do well. And I've just shown recent examination, 8 have failed in theory itself. So don't take theory lightly. We always have an impression that if you've written something, you'll get the marks, but not anymore. Now the question is divided. Examiner will see exactly every sort of sub question whether you've written properly, and then the marks are again divided. So we don't look at the whole thing and give say 6 out of 10. We will go through every subsection and give you marks accordingly. And the examiner, you should be able to understand. So what I've done now is that when we check these theory papers, these are the kind of preparations we get. And I remember checking a lot of papers with Naveen and other colleagues. And sometimes it's full of humor because something is written is very funny. And sometimes it's very frustrating. We are already very tired. We have been checking paper after paper. And sometimes we really get very upset with this. And we are really busy people. You can see we have a pile of papers to finish. And if you're presented well, written in a classified manner, then we are able to check those papers correctly. What are the common problems that we see? One is the question has not been read correctly. And I'm going to give you some examples as I go ahead. We see a lot of maldistribution answer papers. So all questions have equal marks, but somebody has written 4 long pages for one question, and the other question of 10 marks is written only half a page. And candidates usually tell me that no, the paper was too long. We could not finish. We just left the last couple of questions. The issue is that you've got a total of 180 minutes. You got 10 questions. So you know we have got roughly 18 minutes per answer. And then you should try to wind up that in 18 to 20 minutes because all these questions have equal marks. So some questions too long, some questions hardly very little. So you're really going to have a lot of problem. Handwriting is a very big issue. I'll show you some examples. We were taught in school that leave a margin when you write something. Many students don't leave any margin left. There are sometimes blank papers or gaps left between questions. We see a lot of incomplete papers, which means poor time management. It is written on the top of the paper. Please maintain the sequence of your questions. Do not write. So you suddenly write question 9 first, then it's question 6, then question 3. And then examiners have a lot of problem in marking. And then we have to go back and forth to see if some question has been missed. So try to maintain the sequence that has been requested for. Do not try to fill a question with unnecessary content because you're wasting time and you're not going to get any marks for writing something which was not asked. And we see that the diagrams which are drawn or the algorithms that we see sometimes are extremely poor. So neatness matters. Then see that you don't write in the margins and see that we can read what you've written and write to the point. So there's some things that we need to tell. I'll show you this example now. You can see this particular answer paper. Now, when I have to now find out what exactly this person has written, there's a lot of additional effort which I need to try to read every word that is written. Try to classify, don't club everything together, and at least try to, if you don't have a good handwriting, at least try to have a legible handwriting which we can easily read. And believe me, when we open a paper, the first thing we see is your handwriting. And a bad handwriting, immediately there is a negative bias in the examiner's mind. Kya likha hai? You hardly can read anything, and we need a lot of extra effort to check this paper. Similarly, this paper has unnecessarily left a blank page in between. So you must always see that there has to be reason to leave, to not leave such blank pages in between. Now I've given you some examples here. Look at this particular question. There's a 26 weeker, 800 grams, and you can see it's been divided. How would you counsel water delivery room interventions, managing transport? What are initial ventilator settings? How do you prevent chronic lung disease? What has happened is that you can see in this particular question that everything is written together. And again, we have to dissect out here that what exactly has it covered all the points or not. So in such kind of things, when there's a specific A, B, C, D, and E, please write specifically and to the point, and you must classify the answer. You say A, write about A, leave a blank, then go to B and write point-wise. So it's easy for us to correct. If you've written everything together, then the examiner has to actually find out what exactly you've written where. and whether you've covered all the points. So do not have an unclassified and untitled content in your theory paper. That makes us very difficult to correct. You can see this particular thing, seizures in a term baby on day one. What is the management algorithm? How do you define refractory hypoglycemia? How do you manage, and what's the prognosis? And you can see here, I've taken this directly from a paper. The person has written the causes of refractory hypoglycemia, which has not been asked at all. We have just told you to define it. And the examiner, if you can read here, has written not asked. He's written here in this particular thing in red ink. So this exam, though person has written something, he doesn't get any marks because that was something written which has not been asked at all. You waste time. So do not write any unnecessary content because you're not going to get any marks for that particular thing. Again, another example. This particular thing, the question is, question C is, what are the advantages of therapeutic hypothermia? 5 points. And you can see the person has written a Sarnat score below on the paper. So another example where what has been asked and what you have written, again, this is filling up the answer with unasked content. Examiner will give a 0 out of 5 for that because we have not asked you this at all. We don't want the Sarnat score in this particular question. And I'm showing you this just to tell you, right, exactly. See, when you say what are advantage of therapeutic hypothermia, you will just write C and you can just write 5 or 6 important points. We do not expect a very long answer. We should be able to see that you've written to the point. In this particular thing, you can see another question here that we have asked modified bell staging strategies and risk factors for NEC prevention, peritoneal drainage versus laparotomy. And this person has written everything about probiotics. And you can see on the right here, he has written what probiotics are, what are the drawbacks, what are the uses of probiotics. And your question actually is not related to probiotics. Again, we say that you again filling up the answer with something that has not been asked at all by the examiner. Now, this is the same question now with another candidate. You can see, first of all, he has classified it, is not cluttered the paper, and he's written specifically with gaps in the middle where he's written the risk factors, he has listed them, the bell staging is written on top. Now, this candidate, though he's written less, he's written in a much classified and point-wise manner, and this candidate will certainly get more marks than the previous one I showed where it was filled up with probiotics. So again, write a precise, concise answer which is classified. This is about another example of PDA, what are clinical and echo-diagnostic criteria, and what is conservative versus aggressive management. Very 3 specific points have been asked. And what has been written on the right, you can see, is completely about management of PD and pharmacological treatment. Now, again, this has not been asked at all. We asked you the incidence, the criteria, and the merits and demerits of conservative versus aggressive management. Again, we realize that this medical management which has been written by this candidate was not asked at all in the question. So again, such kind of things are very common. So please read your question very carefully. Again, what I mentioned before, look at this candidate, he's completely filled up the margins. So you do not, even the school teacher used to tell us that don't write in the margins. You can see this candidate writing exactly covering the entire paper. And this also does not create a very good impression. Sometimes they start writing right on the top, even above the line. So please see that you don't write in margins when you write in the exam. Now, another example, you can see that this is a 10-mark question. They were asked about the international classification of ROP, what is threshold ROP and laser versus anti-VEGF. And you can see this answer given on the right. It's a 10-mark question for which we have only one diagram, which is very small, and we see just one line on top. Now, this candidate for 10 marks is hardly written anything. This is a very short and incomplete content, and the examiner will not give more than 1 mark for this 10-mark question. Again, maybe the candidate wrote too much about the other questions, did not write much about this, and he's lost time, and he loses nearly 9 marks for just writing such an incomplete kind of an answer. Now, there is some humor also. Here we've been asked about role of microbiome in neonatal disease. And you can see what is written, that a microbiome team should come and they should look after microbiota, infection control and quality care. Now, this is something that is completely tangential. This candidate doesn't know what a microbiome means. So please, sometimes there is a lot of humor and fun, but you must read your questions very, very carefully. This person will get a 0 for this because he doesn't even know what a microbiome. So be very careful with what is written and don't make any self-made and ridiculous kind of terms. Examiners are very impressed when you write diagrams, when you draw beautiful diagrams and you write an algorithm. Now look at this diagram now. This has shown a PDA. Now this diagram has virtually no meaning. And this diagram is like a school child who's drawn it. So if you want to have a diagram, have a proper diagram, label it well, draw a nice clean one. So this is something which is drawn just for a heck of it. And such kind of poor diagrams will not give you any marks whatsoever. At least a few diagrams, draw them well and correctly and label them properly. Now, again, you can see this particular very cramped and untidy work. So this algorithm, see, there is no shortage of paper. You can have any supplements that you like. But here, this same algorithm could have been spaced out on a separate page. There was no need to cramp it here like this. And this, again, cramped, untidy work really creates a very bad impression. So use more paper, draw them on separate sheets, write a little bit of a few capital letters, leave some gaps. So let your algorithm be a little neat and fine. Now I'll show you one of these old papers, causes of acute kidney injury and postnatal management. You can see this particular candidate, it's a good candidate. And you can see how well he's written. He's not written the margins, reasonably good handwriting. You can see that he's underlined important things. You can see the table where he has shown the comparisons and look at the algorithm on the right of the paper. So when you write like this, you're going to get maximum marks. So this kind of candidate will easily get around 8 marks out of 10 for writing neatly and to the point. He's finished the entire question in just 2 pages, which is enough for us with everything important has been covered. So I've shown you some bad papers. I'm showing you a good candidate also. So please, in your theory paper, please do extremely well. So just to summarize, I'll say that take your theory paper seriously. Don't take it lightly. There are sufficient number of marks. You can know 150 marks out of 350 is a lot. Please divide time equally between all questions. Read the question allotted marks carefully and answer precisely with titles. So it facilitates the evaluation by the examiner. Please do not write what has not been asked to you. Keep your handwriting as legible. You can practice a little if you want before. We do make our fellowship candidate write. I make my nurses write. I give them some questions. I see how they write before the exam. Never write in the margins. Diagrams only if indicated and draw them with a pencil and neatly. Do not use red ink at any time in the paper. Use only black or blue ink. Never use red ink. That's only for the examiners. And do not disclose identity on the answer sheet because that also we take it seriously. We just your number should be there. We do not want your name or institution to be revealed on the answer sheet. So these were a few of my thoughts about the theory. And I hope that you will get some tips from this and do your level best and score enough marks in the theory. So I was also asked to talk a little bit by Dr. Nikant about the practicals, but I'll leave that to Dr. Naveen. But a few things I just wanted to mention, just 3 or 4 quick points. One is when you're presenting to the examiner, you do not stop in between till the examiner tells you to stop. Again, listen to the question very carefully, answer to the point, and never suddenly go into a block because some candidate just stop talking that the examiner keeps on looking at them. If you don't know something, quickly say that I'm sorry, I don't know. Never tell the examiner you can do this, you can start feeds, you can start TPN, you can extubate. So that is a wrong way of saying it. The candidate should always say that I will, or this should be done. So never tell the examiner that you can do that. And many candidates use that terminology with us that you can do this. If you want, you can start steroids, you can do this. So that examiners don't like. You say, I will do this. That shows your confidence. If there's a disagreement with the examiner, you can always say that, sir, in the unit that I was trained, this is the way we do it. And again, remember that only the basics are going to be tested out very clearly in your fellowship examination. All of you who have worked sincerely are going to be able to answer very simple questions. So do well, be confident, and come again in the practicals, talk to the point. So Dr. Nalinikant, I end here. I hand over to Naveen now. And if there are any questions the candidate can have, they can put it in the chat boxes.
So thank you so briefly and to the point, and all the tips you have to cover through your presentation. So it is learning for all the students. And for us also, it's a learning point how to look into the papers when we are correcting. So with this, actually, I will request Naveen sir to start the clinical paper when they're presenting the students, what's expected from the students and what do we expect from the examiner also parallelly will learn. But in the meantime, all the questions we are noting down in both the faculties. I will request sir, whatever questions you want to take to answer, you can directly pick those answers, or I will read out later in the end of the session.
Thank you, Mr. I wish I had heard you earlier. 4-5 mark तो बढ़ ही जाते मेरे भी. And very clear messages and relevant messages, like, to be honest, that sometimes when we get close to examinations, we get nervous and don't pay attention to detail. The next presentation is only about 6 or 7 minutes, and this will be what is called as marking scheme, basically, so that examiners who are also in the same Zoom meeting, all your examiners except those who had some emergency are in the Zoom meeting, and the students are there. We want to have a transparent process. You should be aware that when you go to a long case, what do you expect? What does the examiner expect? And a short case and so on. So April 12th would be theory. This is broadly the structure. If there is some change, we will let you know that you would be having the theory examination from 9 a.m. to 12. Try to be available there by 8, 8:15, 8:30, but not beyond that. Please allow some margin. It is something important to you. Lunch would be arranged. There would be a practical theory MCQs, which is easy to score, so prepare well for them. And then an OSCE is conducted on the previous day itself. Even though this is evaluated as a practical mark, it would get over on 12th of April. Theory examinations, like Sir said, would have 100 marks, and paper 2 MCQ would have 50 marks. MCQs would be quite unambiguous, and there would be no negative marking on the MCQs. There would be no, we would try to make an effort that no MCQ questions are out of standard textbooks. OSCE would be again, most of them will be shown as a PowerPoint presentation in a common hall, and same OSCE questions would be asked across the country. There would be 4 questions with 5 marks each, and only 1 question and 1 sub question, that is 2.5, 2.5. We will not try to break it into 4 or 3 subparts, which not only add difficulty in evaluation, they also add difficulty in answering for a candidate. So there would be only 1 main question and 1 sub question. For the practicals, you will have, this is the most important part you need to know, 70 marks for the long case and 40 for the short case. The long case, this is for attention to my examiner colleagues also. So you would allot a case who is on respiratory support or multi-organ support. Why I use this word is, fortunately today we have less babies on invasive ventilation. So coordinators of examination center need not get upset if you don't have 5 babies on ventilator intubated that day. You could have a baby on high flow nasal cannula, on CPAP, a baby who has peritoneal dialysis post-surgery, inotropes, basically a baby who is having illnesses who can be evaluated. So any organ failure can be included. 30 minutes would be given to each candidate. Coordinators of centers need to have 1 independent nurse or an office person who would be very independently ringing the bell at 25 minutes and then 5 more minutes to go. We have to keep time, not only for the sake of examiners to finish the whole day, for candidates also to not get tired out. 70 marks would be there, and 10 minutes would be given to the candidate to come settle down near the baby, just look around and touch the baby, get the details that you would want. But in acute case, we are not expecting them to take any history from the attendant or family member who is there with the baby. So this is to note, in an acute case, we are only asking you, like you do rounds on the bedside, to see a sick baby and make evaluations. Examiners would get 20 minutes and to examine this candidate. Marking scheme would be something like this. To assess the sickness, we would allot 20 marks. So you would have to list out problem listing, that which organs are involved. It could be respiratory failure, seizure, feed intolerance, suspect sepsis, whatever you want. So make major diagnosis, try to reflect on severity of the illness, adequacy of support, whether you think, and like Umesh sir said, please avoid too many negative remarks that I was not given this information, I was not given this information. You may just state that if I had this information, I could have made more clear in making an assessment. But adequacy of support can again be judged like this baby is probably ready for extubation, or this baby needs to have little bit more pressures because retractions are severe and something like that. A care plan has to be given both in terms of diagnostics and therapeutics. So spend 1 minute at least in scribbling on your answer sheet so that you can be organized when you answer as to what tests may be required. They may ask you how many blood gases you would do, whether you need an X-ray or not, and so on. Also, you would be asked to brief a nurse who may be an actor or maybe a real nurse as to what anticipation of emergencies should be there on that day if you're dealing with the acute care. And then if you have done well till here, gets enough time to discuss the disease. So they may ask questions on RDS, on NEC. They may ask what is antenatal steroid. They may ask you what is phototherapy. So they can ask theoretical questions associated with the tests and treatments. And lastly, you should be able to clearly summarize to a family or to the nursing team what is happening in this scenario. So that would have 10 marks. So you would go down into the last part of the marking scheme if you answer well and keep the time. For short case, it could be a baby with a simple problem like neonatal jaundice, a stable newborn also, although I know Sushma madam had suggested in a mail to me that this should be the last resort for having a case for the exam. It can be growing preterm for most of you, but it could be a post-operative baby who's recovering. 40 marks for a short case, 20 minutes. Again, timekeeping will be critical for coordinators of exam. Candidate gets 10 minutes to see the baby, and he may, in this case, be allowed to interact with either the family or a person who is helping in the exam to get short history. And the case presentation and discussion gets only 10 minutes. Now, what is a marking scheme for a short case for 40 marks? So please pay attention. It's a growing preterm in most babies, and therefore, what nutrition is happening? Is he getting milk, formula milk, supplements? Is the growth appropriate? And demonstration of clinical signs may be asked to you. You may be asked to show a popliteal angle, or you may be asked to demonstrate how you would feel for the kidneys, how you would look for hip dislocation. That could be based on the case. Medical and surgical issues pertinent to the case may be discussed as theoretical, like in the previous one. And very important, 10 marks can be on post-discharge care planning for this recovering patient, including follow-up can be asked. So this would be a broad marking scheme which our examiner colleagues and candidates both would find. This PowerPoint presentation is open and can be shared to the group later on. Skill stations would have NRP. Most of them would be true simulations. Examination centers would arrange a separate room which would have everything like it would be in a labor room setting or an emergency room setting. You can be asked even to find out what equipment is missing. You may want to do right from the beginning, like when they say, what would you do if a twin is going to deliver? It would include things like I would talk to the obstetrician, I would talk to the family, they all have marks. And communication and counseling, although gets only 5 marks, is a very important station. Viva would have 3 tables, and based on the last 3 examinations, gradually the marks for Viva has been decreased so that we will get more marks for direct core cases, and they would have 10 marks each on these stations. If you already have submitted to the examination center that you are having a research paper in terms of a publication, a paper presented at a state or national conference, then please bring the kind of what would be an evidence in the form of an email invite from the examination, from the conference, or a certificate copy or a publication copy. And then you don't have to go to the research station. You get full 10 marks straight away. If you have not been, then also don't get disappointed. You can still score maximum marks. Then you would be asked some basic questions either from a journal club like situation or from some work that you might have read or seen. Internal assessment marks already would come in from as your form is being submitted with 10 marks with 2 different examiners evaluating you. You have to pass both separately in theory and practical, and unfortunately, if you don't make it, you take both the examinations next year again. So you don't, if you pass the theory, you don't escape appearing for the theory next time. This was the case a few years back. So this amendment was made by the office that if a candidate does not clear, it is fail in the examination altogether. So if you don't clear the practicals, next year you write theory and practical all over again. So this is all from my end. This PowerPoint is going to be available. This is a marking scheme structure to help us to be uniform. It is not hard and fast. This can change a little bit based on the type of case that you get. Back to Nalini and Umesh sir.
Thank you, sir. Thank you. Perfectly, it is with a short time. Probably the trainees who are attending, it's a guide to them. And equally, probably for us also, same thing, we should understand how the marks distribution goes. So, Naveen Bajaj, sir, any question from your side?
No, I was just wondering, 10 minutes for a long case, isn't it less? Look, seems to be less for the student part. We have 30 minutes, 10 for students and 20 minutes for examiner. Naveen, you are
So please
muted.
unmute, sir. Naveen.
This 10 minutes is only the independent time for them to settle down by the case and see. Like we have even in the DM examinations, virtually the case starts as soon as the candidate reaches the so even in the 10 minutes that they're spending with the baby, your examiners will be standing near you and seeing what you're doing, how you are touching the baby, how you're turning the baby around, how you are handling the systems. So that 10 minutes is only to give you that much time to.
The
But
10
your
minutes is with the examiner sort of, but they will
yes,
have case much before that.
yes. So the only this was only some kind of a time allocation because to get an idea, but this 10
So
could become
total
on your
assessment times looks like 30 minutes.
30 minutes. And the key message is that in this case, they don't have to do any history taking. They're only examining the baby. They may be given a few points from uh, from the what we would call as the person who is conducting the examination for you. They may give you a few points that this baby had this, and many examiners would allow them to ask 3 or 4 questions to the skilled attendant. Yeah, I was not getting the word. The skilled attendant who is helping to conduct the exams. You may want to ask that did this baby get resuscitated at birth or not, and that kind of question.
Naveen, does it mean that, the patient, yeah, hi,
Yeah.
Vinay here. Does it mean that the candidate will get the allotted patient, that time itself? So he will be there with the patient and examiner for 30 minutes together, correct?
Yeah.
He doesn't
Yeah.
get the case beforehand.
No.
Okay. Yeah.
They
Okay.
go live to the baby. This is for all the, because in our meeting, we are having students and examiners together. So they go and even your hand washing, even the way you warm up your hands before you touch the baby, and the way you do not touch those parts which were not allowed without permission from the nurse, all these are being observed. And only that you get 10 minutes before the examiners start firing questions to you.
Okay. Got it.
Can we take few of the questions from the students' queries and trainees' query?
Yes.
This question repeatedly comes actually, what things we have to bring for practical exam? Growth chart, tab, or any kit, neuro kit, measuring tape. Should we carry that or the center will provide us? That's the question comes repeatedly.
I think the answer is very easy, Nalini. They should carry everything that they would carry with them if they're going to be neonatologists by the baby's bedside. So they don't have to carry a stethoscope, it would be there on the bedside. But carrying a tape, or if they want to have a growth chart, they're permitted because they are not going to be able to copy anything from there. So they can carry the growth charts, they can carry the kits that they want. If they want any tiny toy or that something red ball, all that is allowed. And there is no objection to bringing it along with them.
Second
Other
question,
examiners could
previous
opine if they have other opinions.
question bank, NMF, do we have a question bank, previous year questions, model questions to get from the site? That's the question came 2 to 3 times to is asking. So the NNF site or anywhere they can get the previous year's question paper, model paper.
I'm having Umesh sir from as a senior member in this office, and I'm asking his permission. Can we share the last year's question paper to the faculty, to the student group's WhatsApp.
Yeah, we can.
Yeah.
We can do that.
Yeah, so that would be the most recent model.
And
Dr.
Naveen,
We would do that.
they are on the website also. I think we should check. I think we have decided to put them on the website for the old papers. So that also
Yes, sir.
we can check if they are on the website.
Yeah, we were having some issues with website being revamped. That's why I did not answer that way. But surely the last year's question paper would come in, and they would help you to know the structure of exam questions. But it would be no clue to what questions are going to come this year.
Hello, Dr. Naveen. I've got a small concern. If you allow them to bring their own tape, we don't know how far they are sterile enough for the babies. Is it
I
safe
understand.
enough?
I was thinking of that. If any center of who is conducting the examination has certain material already on the baby's bedside, in that morning briefing, you could, or in your WhatsApp group, you could clarify that we are going to provide all this material. Please do not carry with you, because you would all have WhatsApp groups with your candidates. At the end of the day, whether candidate brings it in or whether we provide it, this is necessary information that is required to be taken care of. So if there is something that your NICU doesn't want them to bring in of their own, please be free to say that you're providing for all the candidates. You're right in that. Completely agree with you.
Sir, one request from a question only. So students asking if the case we will get simultaneously parallelly when the examiner comes same time. Should they write the history or examination findings when they examining parallelly in the answer sheet or some of the sheet, or directly they can present to examiner? Or should they document also what they have observed?
Yeah.
If only 10 minutes they will get what?
Yeah, I would not give them rules, because all these are senior examiners and many of them would probably not look at your answer sheet to give you marks on that. But there is something called mind map or map in writing. So it's always a smart thing to have at least 8 or 10 bullet points jotted on your answer sheet, that what is the working diagnosis that I have made, what are the positive findings that I found, physical examination findings, some 8 or 10 jotted points that will help you to make your presentation more effectively. But all examiners who have been conducting, Naveen, Umesh, can make a suggestion on this. I don't remember having taken an answer sheet from a candidate to see whether we are giving marks based on that in the practical exam. Naveen?
Yeah, in practical, we don't see answer sheet, but it is for their help. That if they want to note a sequence of events, they want to present some sequence of events or positive signs. It is for their help. They can write anything they want on that sheet according to their plan or the baby they have. Otherwise, that is not being checked and marked.
Sometimes
What
they
is-
measure, etc. They may forget, so they have measured the head circumference. They may not remember by mind, so they can just write it down for those little bit of informations. And mind map is, I think, what is important. They have noted all things. Sometimes they can just look at the paper when they're presenting to us.
Dr. Nalini, Dr. Surendra has told me to join the other meeting, so I'll take your leave.
Thank you, sir. Thank you for
join that other meeting of NNF. So I will just take your leave from this
Thank you.
program. Yeah.
Thank you,
think
sir.
we are almost through with the meeting. Any of the examiners can post their queries or suggestions. And thank you everyone for joining in. We might not have answered all the questions, but we had made a promise that we will wind up by 9. Any closing remarks from Nalini, please?
No, this is a great session for till now, actually, for I hope for all the exam going candidates, the tips in a single 1 hour platform to get all the rules and regulation tips and how the expectation from the examiner. They all probably got a clear message here, but we got some ideas as examiner also. The old examiners and we got an idea what we should expect from the students, how to carry ourselves also. We got idea. So this is a useful session for both the examiner and students. But any of the quick inputs or queries and suggestions from all the faculty examiners are there. So if quick, otherwise we can wind up the session, sir, because it is now in another 5 minutes. We will close the session as we promised.
Dr. Naveen,
Thank you
you will be sharing this presentation at
Yes. Yes.
Yeah. Okay. Thank you.
This presentation, Naveen sir already the presentation simple rules are there. The examiner groups probably will be posted, sir. We'll decide from there.
Right. Good. It was a useful session. Thank you.
Thank you, sir.
Any other examiners who want to please add in something before Nalini closes the session?
Just for the students, then don't try to, you have to answer each and every question. Even if you don't know, then don't try to do blunders in during the examination process.
I
You
think
are,
a reassuring word from our
that
side,
is,
we are to pass you. We are not here to fail you. So don't be afraid of us. We are your friends, colleagues, and we all of us have to work together to improve the newborn health in the country. So we are friends. Take us as friends. We'll be helping you. Thank you so much.
so that will be a sort of negative mark. So if you don't know, that is okay. You can. Everyone doesn't know the 100% of all the question examiner fires. Even we at our stage, many times we were not sure of what answer we should be giving. So that is okay if you don't know all the questions.
Thank you. All the best.
Thank you. Thank you. Thank you, all of you, sir. There's Naveen sir, specifically Naveen sir and Umesh Bhatia sir for the great inputs and all the faculties who joined. Thank you all. Bye. We'll join the next
Bye-bye.
session.
Thanks.
All the trainees, the quick tips, all the trainees. Next Monday, we have fixed a from NNF one virtual mock bedside examination for 2 students, half an hour. Directly, they will go bedside, and 2 of the faculties or 3 faculties will ask quick questions. We'll do that on Monday. We have booked a slot from NNF. It is not NOEL Thursday session. It is a Monday session, evening, 1 hour, 30 minutes each. 2 students, 2 questions. We will do mock examination. Now we know the rules, and we will live 2 mock examination. Probably will just before 1 week before the examination. It will probably helpful for all the students. Thank you all. Thank you. Good night.
Good day. Bye-bye.